Welcome to the Clinical Podcast series brought to you by the American Academy of Optometry Foundation. The topic for this episode is pre-participation vision screening and comprehensive eye care in National Collegiate Athletic Association athletes. I'd like to thank our host, Dr. April Jasper, our topical expert, Dr. Nick Fote, and our topical editor, Dr. Maureen Plaumann. Dr. Jasper, over to you in the studio.
Hi, everyone. I'm April Jasper, and I'm speaking today with Nick Fote about the Weiss et al. July 2021 OVS paper. Wait for the title. Here it comes. Pre-participation vision screening and comprehensive eye care in National Collegiate Athletic Association athletes. Welcome, Nick. It's so good to be able to talk together.
Thank you. Great to be able to talk to you.
So I want to start out with you giving us a brief introduction to the paper. That title is super complicated, but I know you're going to make it a lot more understandable and simple to us.
Thanks. I hope so. So what this paper was about was asking the question, when athletes go through a pre-participation screening, are they referred to a great enough degree? In other words, if there's another issue going on that is not caught by the screening, how often does that happen, and what can be done about it?
Okay, so tell us first then, what are the goals of this pre-participation athlete vision screening?
So the athlete screening includes a number of portions, as I understand it, one of which is vision. The main things that they are attempting to accomplish through this screening are to make sure that there's nothing life-threatening or disabling that would predispose a person to an injury or an illness, and to provide healthcare to athletes who, as we'll talk about in a minute, may have limited access to care. Really, in sort of summary, the major goals are to ensure that the athlete is safe and to provide medical clearance to participate.
Wow, incredible. So what are the criteria then to pass the pre-participation screening?
So speaking specifically about vision, the major things are the acuity criteria, which is 20/40 in each eye. If there is a difference of 2 or more lines between the two eyes, that would constitute requiring a referral. And if a physician, this is how it's written in the paper, if a physician notes an ocular issue, then that would also constitute a reason to refer for a comprehensive exam.
Okay, so then break it down a little more for us. Who was included in the study?
These were 58 University of Alabama Birmingham football players who had completed a pre-participation screening and then agreed to go through a comprehensive exam to see whether, in fact, that pre-participation screening did turn up most of the issues that would affect their performance on the field.
And now for the exciting part, what were the primary findings of the study?
So interestingly, about 60% of these individuals, 60% of the 58, so that's 34 out of 58, had improved visual acuity after a comprehensive exam, on average about 1 line. There were a number of individuals who were deemed to require a refractive correction, a prescription. Those individuals included people who were improved 2 or more lines with the refractive correction, or wanted to wear a refractive correction on the field. Of those, about 16 out of 18 decided to wear contacts for their refractive correction. So quite clearly, and I didn't point this out earlier, 55 of 58 passed the screening, which is about 95%. But once we got to the point where the comprehensive exam occurred, then again, about 60% of those individuals needed a refractive correction or could use a refractive correction. There were also, if you added in everyone who had an issue with the NPC, near point of convergence, that is the DEM, developmental eye movement test, or required a refractive correction, or had some sort of pathology, that was 81%. So we went from 95% passing to 81% through the comprehensive exam needing some sort of additional care.
So what would you say from all that you've read and seen in the study, what would you say are the key clinical takeaways for all of us?
Well, certainly the major conclusion, I think, from this is that pre-participation screenings and the 20/40 acuity level do miss quite a few individuals who would benefit from refractive correction or a baseline concussion test, the NPC or developmental eye movement test, or who may have pathology. So there were actually 3 individuals through the comprehensive exam that were diagnosed with pathology, and only one of those 3 did not pass the screening. So that included a keratoconus patient, patient with a retinal detachment, and a patient with pathological myopia. So I think that's the major takeaway. The majority of the athletes did choose to wear their correction and pursued contact lens fitting. So I think that's interesting and something that we should probably as optometrists have in our minds. And then finally, pre-participation screenings are definitely not designed to address other aspects of vision other than acuity, such as NPC and the developmental eye movement test. Finally, optometrists may consider partnering with local sports teams because 60% of the athletes in the study had never received a dilated eye exam, or it had been 10 years since they had one. So clearly, while the authors say that we should and that it should be balanced, comprehensive eye exam with the ability to complete these eye exams, the time and the resources, it looks like from this study that the yield on the number of ocular problems found is significantly higher with a comprehensive exam than a pre-participation screening.
Wow, that's pretty incredible. I think that some of us probably just assume that all these athletes have had comprehensive eye exams. So it's a great study, good information, and I agree, a good opportunity as well for us to partner with some of these teams and athletes to make sure that they're cared for well. Nick, thank you so much for bringing this to us, and we'll get together and have another conversation soon.
Okay, thank you.
And a special thanks to CooperVision for their educational grant to make it all happen.